the following conditions, and is the patient at increased risk for due to her history of cesarean sections? Um, Let me just see. Let me just read. Gravida 3, Para 2. So she's had pregnancies before. They were both cesareans. She's stable, no distress. We have a placenta previa with the placenta covering the internal os. Which of the following conditions is the patient at increased risk for due to her cesareans? Okay, well, even though through in the placenta previa, the cesareal thing, let's see. Oh, what wasn't the answer I was thinking of? At first I was going to say uterine rupture, just because with the C-sections, but let's see what we're left with. We had the C-sections. I think it might be a risk factor for some type of acrida or I mean, technically there's acrida, incrida, percrida, and like they each get worse, like more tied into the myometrium or like all the way through it. But
Okay.
I'm gonna go with acrida, I guess, because it's the primary one.
Yeah, so right, Increta, right, risk factors attaches deeply into the uterine wall, making it deeper, right? Increta is more severe, where the myometer used while the patient is increased for abnormal placenta attachment due to a C-section. Accreta is more common than Increta, right? So it's kind of, picking which one's the best answer, right? Of course, it's an increased risk for acreta, increta, or percreta, right? The way I remember it is because you practically put an incision through the uterus, correct? When you do a C-section. So that tissue, when it heals, right, the placenta can kind of invaginate there. And so yeah, your best answer is the least form, right? It's at most increased risk for increta, probably partial increase for increta, and then a little bit increased risk for percreta, but it's how the placenta can attach there. So good.